Thank you. I think, as Kevin said, it's either a question of great minds think alike or a question of us not talking to each other enough. Because funnily enough, we've actually come to some really similar conclusions in these two reports that have been written in separate places across different parts of London. But I guess ours being ODI, we've come from a more of a kind of research type background. So what I wanted to do is sort of go into a little bit more of the social compact, why we think this is so important and why we think this is so critical for poverty reduction. So we did that by first saying, okay, well, let's look at some of the poverty trends. What has happened to poverty and what is going to likely to be happening to poverty in the future? And this is the good news. This is well known, but I think it's quite useful to have it in a graph here that there has been a significant reduction in poverty over the last 15 or so years. It was 43% of people were living in extreme poverty. This is $1 a day or $1.25 a day poverty. In 1990, and by 2011 it was down to 17%. If you are sharp-eyed, however, you will realise that the yellow bar, which is sub-Saharan Africa, actually increases. So the absolute number of people living in poverty in sub-Saharan Africa has actually increased over the past 10 or 15 years. And the really, really good news story has happened in East Asia and the Pacific, as you can see. So that's the past. What about the future? Now, projecting poverty trends into the future is incredibly difficult, but most economists do it by looking at rates of economic growth and rates of inequality. So how fast are you growing and how is that growth shared? And you can get a range of forecasts based on those two variables. Now, again, there's good news and bad news here. The good news is that actually most of the projections show that if you have positive growth, good levels of growth based on previous projections, and if inequality doesn't get worse, you can get fairly close to zero, not to zero by 2030, but not a million miles away from zero, if you have those two things. The best case scenario does actually get you to somewhere around 3, 4, 5%. If you have lower growth, and particularly if you have worsening inequality, you actually get much higher levels of poverty. So really, it sounds sort of tautological and obvious, but if we're going to tackle poverty, we need to tackle both growth and also, particularly, we need to tackle inequality. One of the things I would say is that none of these projections factor in climate change. As everybody knows, climate change is likely to have significant impacts on poverty. And we looked in many places. There's been some case study analysis in the UK, but done by ODI, but nobody had actually mapped that against these sort of trends. So you have to bear that in mind. But really, good growth and good levels of inequality could get us fairly close to zero poverty by 2030. But again, it's going to be very variable by region. So here you see these are projections, I think, from the World Bank for 2011 and 2030, showing the numbers of people expected to live in extreme poverty across regions. And as you can see, it shrinks down to almost nothing in South Asia, East Asia, and the Pacific. But again, it continues to increase in sub-Saharan Africa. So we're looking at a situation in which poverty has increased over the last 15 years and is likely to continue to do so in sub-Saharan Africa. We don't have it on these slides, but the picture in fragile states is even more dramatic. The projections are showing that by 2030, somewhere between 2/3 and 3/4 of poor people will be living in fragile states by 2030. So tackling extreme poverty, getting to SDG Goal 1, which is about eradicating extreme poverty, must mean tackling poverty in fragile states and taking international action in fragile states. So what do we need? And this is where we have a nice congruence of interests here. We need a new global social compact. And the way I sort of see this global social compact is the way we need to think about it is to say, if you are a person, wherever you are living, whichever country you are living in, you should have a basic minimum package available to you. You should have healthcare. However poor you are, however rich you are, you should have basic healthcare. You should have basic education, basic quality education, primary and lower secondary for your children, and you should also have a basic level of income security through social protection. Now, of course, these things are nationally determined. They need to be calibrated to national context and so on. We're certainly not imposing a one-size-fits-all type approach, but we do think that this is about being a human being in the 21st century, is that you should have access to these basic things. Health and education, we probably don't need to persuade anybody here how important they are. On health, I would say, though, that universal health coverage, which means access to healthcare regardless of willingness to pay, that's probably not the technical definition, but that's how I understand it, is actually really critical within health. And there's a lot of literature on this which says it's not just about health, it's actually about that universal health coverage, which is preventing people from falling back into poverty once they've come out of poverty, and obviously lifting people out of poverty in the first place. Social protection is one of those issues that wasn't so important in the MDG era, but I think that there's a lot of evidence now that actually social protection, and particularly social transfers, can actually be really critical in reducing poverty. And also, by the way, all of these things do improve the levels of sort of pro-poor, inclusive growth and make that growth more equal over time. The other thing that's critical about these three areas is that they need public financing. Now, this is a wide debate, and of course, countries need to make different, may make their own decisions on this. But when we've looked at the evidence, it's very hard to see how private financing can actually meet the needs of this basic social compact. So I very much agree with Eloise about this is a basic package that needs to be provided and needs to be provided publicly. So, how much is it going to cost? Here's some more graphs, slightly different graphs to the one Eloise had put up. But what we did is to basically calculate the cost of the social compact, the aid available, and the revenue capacity available. So the yellow line that you see there is the social compact cost, and we've only shown it for low-income countries here. We do in the report have it for all countries, including, well, all countries with a population of above 1 million people and a poverty line, rate of poverty above 1%, something like that. But it's about 90 countries we've looked at. So the social compact cost here, we calculated based on the cost of a cash transfer to lift everybody up to the poverty line, taking account of administration and leakage costs. We used country-by-country education calculation, and then we used universal health coverage. I think it's a flat rate by Chatham House. They estimated what it would cost across different countries. So we aggregated all of those things up, and that's where you get this social compact cost. We then looked at the potential revenue that countries had available to fund that social compact. We looked at some estimates put together by the World Bank and IMF, not of actual tax revenues, but of potential tax revenues. And this is really important because obviously you don't want to be giving more money to countries that aren't raising their own tax. We all agree that raising taxes is critical. But this was based, so the IMF and the World Bank looked at what could countries feasibly expect to collect based on their economic structure and their current level of income and so on and so forth. And we assumed that half of that maybe could be spent on these areas. It's 60% in the OECD, which is probably a little high for low-income countries. So that's where we ended up with 50%. And similarly, 50% of the available aid could be spent on these sectors. And that's very much because, obviously, aid also needs to be spent on infrastructure and the other areas. So what you see here very clearly is that there is an enormous financing gap, and there is a particularly enormous financing gap for the least developed countries and the fragile states, and there's quite a lot of overlap, obviously, between those two groups. You can't see it on this graph, but actually most of the middle-income countries actually can self-finance this if they choose to. Some of the lower middle-income countries still have a gap, but the majority of the middle-income countries don't. So this is where we get this enormous financing gap, and this is absolutely why we fully endorse this 50% of LDC's target. So our total cost numbers are slightly different from yours. We'll maybe have to have a discussion about that at some point. But when we look at the overall level of financing across low-income countries specifically, we find that it comes to 148 billion. We find that 75 of this, so roughly half, could be funded by countries themselves if they did collect tax revenues in line with capacity and allocated it to these areas. But that does leave a $73 billion shortfall in those countries. There's actually also another 11 billion in middle-income countries, but this is just the LIC figures. So even if countries are raising taxes in line with their expectations, this is where we end up. So what do we want to see in Addis? We've also got 5, although some of them are subdivided, 5 key recommendations. The first, the obvious one, is the 0.7% of national income. we've calculated that actually if everybody gave 0.7%, then you'd have enough money to fund the social compact. Obviously, you'll have other priorities, infrastructure, global public goods, and so on. So it probably still wouldn't be enough, to be honest, but the 0.7% target would go a long way to getting to that position. The second important point is about bringing emerging economies into the system as contributors. Emerging economies are providing higher amounts of South-South cooperation, but often it's not monitored and it's not very transparent and it's very hard for countries to manage. So they need to be brought into the system. Thirdly, as I've mentioned, the 50% towards the poorest countries. Our figures actually showed that for the social compact, if you were going to redirect aid just in line with those costs, actually you'd need more like 70 or 80% to LDCs. That's obviously difficult politically, but at least 50% would be a very good start towards that objective. Fourth, this is a really important one. It's obviously not just about the volume of resources, it's about the effectiveness of resources. There's actually 3 reasons why you need to think again about effectiveness post the Paris agenda, that there's going to be more spending in fragile states. We've also learned the lessons from the last 10 years of aid spending under the Paris aid effectiveness agenda. So you need smarter, you need long-term approaches, you need more risk sharing and more flexible ways to provide aid. And then finally, and I will wrap up because I'm probably over time, we need to have new funds in the global system for areas where we don't have them, and we need to expand existing funds to where they're too narrow. I'll give you 2 examples on expansion of existing funds. The Global Funds for AIDS, TB and Malaria does a lot of good work. It's achieved a lot, but it is very narrowly focused on those diseases, and it needs to be broadened out to focus on health system strengthening. And on social protection particularly, there's no long-term multilateral financing mechanism to support social protection. So we think that that's something that should also be committed at Addis.
Thanks very much, Roman.
Yeah.
Actually, I think I know the answer to this question, but I feel duty-bound to ask it. You know, if you listen to a lot of African governments, African leaders, what they want to talk about in Addis is growth and financing for infrastructure and roads and ports. And, to summarise, this would look like a very sort of traditional aid agenda. How would you respond to the challenge that maybe this doesn't reflect the priorities of many leaders in Africa and elsewhere?
I think there's two things. One is these things are actually necessary for pro-poor growth. You can talk about growth till you're blue in the face, but if you have growth and worsening equality, you're not going to get poverty reduction. So as we were saying in those earlier graphs, actually it's not just about the growth, it's also about the inequality. The health, education and social protection, all of them will promote growth, and they will also promote the right kind of growth. That's the first thing. And the second thing is that we looked quite a lot at what is the role of aid in supporting growth. And we actually concluded that growth is a great thing. Nobody is against growth. But actually, there isn't very much evidence that aid itself can be used to promote growth. So there's obviously lots of other policy issues and so on that can support that objective, and we are certainly not saying that that's not important. But if you're thinking about aid and how do we best use aid, actually trying directly to use aid to stimulate growth is not necessarily the best use of resources.
Okay.